tactile cue knee exercise. So the setup for this exercise is pretty simple. You just need an anchor point, which is around knee height. Okay? Then you're going to step into the band, making sure that you're facing the anchor point. That's the important bit, and that the band is in what I like to call the knee pit. Okay, at the back of the joint. Now, if you do have something like classical EDS, your skin's a little bit sensitive in that area, it might be quite thin, velvety, fragile. Don't be a hero with this. Use something like a hand towel or a towel to make it far more comfortable. So we just place it around the band, we let go, and there we go, all set up, ready to rock and roll with the exercise. So for this exercise demonstration, I'm going to get rid of the towel though, make Johnny suffer a little bit, pretty much for one reason, just so you guys can see what's going on. So this exercise is all about hitting knee extension and utilizing the VMO, okay, the vastus medialis obliquus muscle. Helps us with things like knee tracking, helps us with knee stability, and it's something that often in rehab gets overlooked quite a lot. So this exercise is pretty simple in kind of performance. All we have to do is make sure that our feet are facing forward. So if you straighten those feet up, Johnny, that's it. And we need to apply a little bit of resistance to the tactile cue. So if you bring yourself back, Johnny, there we go. What we want is enough resistance that if you were to relax this foot, it should go forward. You see how the band's literally pulling Johnny into knee flexion. This is good. So to perform the exercise, what we want to do now is we want to push the knee back as we drive the heel down, lift the toes up, push the knee back. One of the best things about having a tactile cue for this exercise is because of the sheer amount of force pulling you into flexion, it will tell your brain exactly where that knee is, and you will find it incredibly hard to hyperextend in this position. However, exercise-wise, just really pay attention to what you're doing, pay attention to your foot position, because what might happen is you might find that as you come down, this foot rotates out. We want to try and keep it straight. If doing it straight is a little bit uncomfortable, maybe your feet are a little bit used to being slightly out, reset up, try your feet in a little bit more of a comfortable position. If you can do it with your feet straight without any pain, that's fantastic. However, if it is a bit uncomfortable when you do it, readjust your foot position, try and find something that's kind of easier for you to do. So back to the exercise. See what Johnny's doing? He's just driving through the heel, lifting the toes. He's not focused really on anything else other than using his quads to drive the knee back. You kind of want to avoid turning this into a hip exercise or a loading exercise. All we're focused is just pushing this quad back and forward. So you could also, while you do this, use your hand and palpate your knee. And where we're aiming for is the inside here. We should really feel a little bit of fire, a little bit of firing of muscles, especially when we get to the last 5 to 10 degrees of leg extension. Weight distribution, we're kind of looking at about 90% weight on this side, and then 10% of weight on the banded leg. But exercise-wise, pretty simple to do. Have a go.